Hi, I'm Lisa Oakley. I'm a nurse practitioner and I specialize in hormone replacement therapy and functional medicine. I think what makes what I do different than what I do in traditional family medicine is that we get to look at each patient in a very individualized manner. Not just treating lab tests, but treating them individually based on their particular symptoms. Functional medicine focuses on what we call upstream medicine, or looking for the root cause instead of waiting until there's a disease present that requires us to treat the disease. It's a lot of disease prevention, and in functional medicine we get to use some tools that are not available to us in traditional medicine. In functional medicine, some of the tools we use are medications, but we also draw from the nutritional aspect, thinking of food as medicine, looking at lifestyle. We use a fair amount of supplementation to try to correct some problems that may be going on physiologically, instead of there again waiting and treating until there's a disease present. A typical office visit involves me taking a very extensive history, both a medical history and a personal history, and trying to get a feel for really what is the patient's experiencing, how is this affecting their everyday life, and what kinds of things have they already tried, which ones were successful or even partially successful, and which ones were of no benefit to them at all. I do a fair amount of testing. The testing we do is more functional. We look at a lot of vitamin markers. We do food allergy testing, saliva testing. It depends on what the situation calls for. But ultimately, we end up with a very individualized treatment plan for that person based on what their tests tell us and also what their symptoms reveal.